Hello, my name is Faisal Aziz and I am a PhD student at Medical University of Graz, Austria, and my study title is Association of Serum Glucose Levels with Disease-Free Survival in Soft Tissue Sarcoma Patients. Background of my study: diabetes is actually implicated in various adverse cancer outcomes and it is quite well known now. However, the hyperglycemia has also shown to be associated with adverse outcome in certain types of cancers. And however, the independent effect of hyperglycemia in soft tissue sarcoma patients has not been well understood and investigated. Therefore, this study aimed at investigating the association of mean serum glucose levels after the curative resection of patients and looked at the association with survival outcomes like overall survival and disease-free survival. Study methods: we employed a retrospective analysis of 430 patients who had localized soft tissue tumors and without established diabetes, and this data was obtained from a public health hospital of Graz, Austria. And the main study variables are demographic characteristics, which included age and gender, and tumor characteristics like tumor size, tumor depth, location of the tumor and tumor grades, and adjuvant therapies like chemotherapies and radiation therapies also. The main outcome are overall survival, which was defined as a time from curative resection surgery till the time of death, and the second outcome was disease-free survival, which was defined as from the date of surgery to the date of tumor recurrence and distant metastasis. In statistical analysis, survival curves were presented in Kaplan-Meier plots, and the effect of post-surgery glycemia on survival outcomes was investigated by using Cox proportional regression model. Study results: the graph 1 shows the overall survival of soft tissue sarcoma patients after they underwent the surgery. The total follow-up time was 17.5 years and the median survival was 13.4 years, which is quite high and it's consistent with the literature also. And the 5-year survival and 10-year survival were 74% and 60%, which is a bit high from the database or the data reported in the England and the UK. The figure 2 shows the disease-free survival, which was stratified as the overall disease-free survival and tumor recurrence-free survival and metastasis-free survival. The overall disease-free survival was presented in green line and tumor recurrence in red line and metastasis-free in black line. You can see the curves here. The figure 3, which are our main results, shows the adjusted Cox proportional regression analysis of overall survival with glycemia and other covariates. The overall survival was worse with increasing levels of glucose, however, this association was not significant. In figure 4, the adjusted Cox proportional regression analysis of disease-free survival with glucose and other variables. And here we can see that increase in glucose by 10 milligram per deciliter actually increased the hazard of disease recurrence by around 10%, which is statistically significant. In addition to this analysis, we also compared survival outcomes between diabetes versus non-diabetes patients. The overall survival was worse in diabetic patients, whereas disease-free survival was not significantly associated. So in conclusion, the mean surgery glucose is significantly associated with worse disease-free survival in soft tissue sarcoma patients, and these findings suggest that glucose may serve as a potential biomarker to determine the prognosis of cancer outcomes. And thank you so much.